Thank you, Madam Deputy Speaker. I must admit I greatly enjoyed the Health Secretary appearing to argue that our health and care sectors need to recover after a decade of Tory government. I couldn't agree more. The COVID-19 pandemic has served to expose the damage from Tory austerity and privatisation to our NHS and social care sector. They're understaffed and underfunded, whilst existing staff are overworked and underpaid. However, unlike the Health Secretary, I don't think further privatisation is the answer, even if he and his pals are already drooling at the thought of selling off the NHS to every Tom, Dick and Tory donor. It's clear that our health and social care sectors are in crisis. Before the pandemic, there were over 100,000 NHS vacancies, while a quarter of staff were more likely to leave than the year before. The government's plan to address this: give NHS staff another real-term pay cut. Added to this, there are an estimated 112,000 social care staff vacancies. Again, with zero hour contracts and the median pay just £8.50 an hour, I don't think there's any great mystery behind these shortages. However, the social care crisis goes beyond staffing. Age UK estimate that there are 1.5 million older people not receiving the necessary social care support that they need. Councils have had their budgets slashed by nearly 50% on average since the Tories came to power, with around £8 billion taken out of social care budget since 2010, so is it any surprise? We desperately need a plan for social care that relieves the pressure on unpaid carers and widens access to adult social care where it's needed, yet the government appear clueless. This crisis requires a dynamic government, one ready to accept the ideological failures of austerity and privatisation, one that's willing to invest in publicly run health and social care services and that rewards workers who staff them. Instead, the promised plan for social care is still missing. Private healthcare firms are being welcomed with open arms, and workers face pay cuts and poverty wages. The Health Secretary speaks about the prevention agenda, but the main cause of ill health isn't obesity alone, it's poverty. He can talk about levelling up, building back better, and the rest of their buzzword bingo, but until they address insecure work, low wages and welfare reform, health inequalities will continue to grow. The government needs to wake up to the health and social care crisis, because the effects are already being felt by real people, the people this government promised to help.